So, Dr. Justin Varney, first of all, welcome back on the show. Tell us about this plan of yours.
So in terms of the local outbreak plan, all local authorities are required to have one and publish them by the end of June, which we did. It sets out for the public how we are structured in terms of our governance, how we make some of our decisions, and the support that we're giving to settings like care homes or workplaces if they have an outbreak of coronavirus. It's a plan that we're going to update quite regularly. And obviously as new things come along, we'll have to change and update it. And particularly, obviously, it was written before the Leicester lockdown. So we're all looking at it now and going, okay, in that kind of scenario, what else would we need to put into the plan?
We'll come on to the Leicester lockdown and the potential similarities as far as Birmingham comes to in just a moment. You said that it's going to be reviewed regularly. Is that a structured review, or is it as and when?
So every month, the Local Outbreak Engagement Board meets. That's a public meeting chaired by the leader of the council. And that's where we discuss our work as we're going along. And as part of that meeting, we'll routinely look at the outbreak plan. And if we need to make any changes, that's the formal governance that we'll take it through. So it's done on a kind of monthly basis. It doesn't mean it stops us doing anything that we need to do urgently in the short term, but that's the kind of formal route that we take it through.
And the local outbreak plan is available for anybody to witness on the Birmingham City Council website. It's there to download and to view to your heart's content. It's a 43-page document. So given the fact that a lot of these, anything to do with government can be quite wordy, I know that myself. So we're going to try and break it down as best as we can in the limited time that we have here. But what I noticed from reading it is that it's broken down into 7 themes. Can we go through those 7 themes?
Yeah, so and this is to do with, as you said, government kind of set out the 7 things that we needed to cover, and that included covering off how we're going to, what our governance structure is going to be, so which committees have we got, and how do they all join up to each other. It included how we were managing data, how we were working with Public Health England, both in the initial stage of responding to an outbreak, when an outbreak's identified or what they call a situation is identified, and then also how we take forward our support for those situations like schools or workplaces, but also how we support particularly vulnerable groups, and that includes people that might be required to isolate for 14 days, but also thinking around people who are particularly vulnerable, for example, such as the homeless. So they kind of gave us things we had to cover, and we've had to tick those boxes as we wrote the plan, but that in essence describes these kind of core parts of what it contains.
What was the time scale, if you can tell us, between finishing the report and it being published?
So we were, I think, like many other authorities, up to the wire. We were asked to do it with a relatively short amount of time to develop it. We took it to the first meeting of the Outbreak Engagement Board. I think it was on the 24th of June. They gave us some additional comments. We then finished off the final draft on the Friday, sent it to the leader and the chair of the Health and Wellbeing Board, Councillor Hamilton. They read it over the weekend and approved it on Monday, and on Tuesday we got it up on the website.
And like we said, it's there if any of our listeners want to have a look at it. The reason I asked about the timescale between it being finished and being published is that, as far as we're concerned here, it's now Sunday lunchtime. As people are listening to this on the radio, we've had the so-called Super Saturday. Were anything that could come from the Super Saturday, say 1-2 weeks down the line from here, were issues like that factored into the writing of this report?
Yes, there were in terms of our response to particularly workplaces, but also in our engagement plan. So one of the things we'd been very conscious of is that the openings were going to continue, and it was really important to get messages across. And one of the annexes is our engagement plan, which was highlighted as good practice by the regional coordinator and translating messages, working with community radio and radio stations like your own broadcasts to get these messages out. One of the challenges we didn't have at the time, which by the time listeners are reading that this has just been published at the end of this week, is the enforcement guidance. And we understand there's more coming. So one of the things that remains a little bit unclear is about where powers lie, and the majority of enforcement around social distancing, for example, sits with the police, and it's also the responsibility to enforce it, and they potentially are then enforced by the health and safety executive. So some of that's still a little bit working through, and that's why the plans are put out as we understand it at the point we published it. Is one of the things that we will be revising as some of the new legislation that's been published off the back of Leicester comes into effect.
And Leicester, the big story in terms of an individual area going back into lockdown from a spike in cases. How close is, or how far away is Birmingham from being in a similar situation?
So pretty far, and it's really important, I think, to kind of set out quite what we're looking at in Leicester. So one of the things we're now starting to look at is what we call the weekly rate of cases, because there is day-to-day fluctuation. And in Birmingham in general, we fluctuate between, on average, 5 or 6 new cases a day. We've had a couple of small spikes where we've gone up to about 20 cases a day. But we are a city of 1.2 million people, so it's really very small numbers. So you look at a rate, which is the number of cases per 100,000 population. Now, as of the end of last week, Leicester had 141 cases per 100,000, and we had 6.5. So you can see massive difference. And Leicester's about a quarter the size of Birmingham. So in terms of the difference in scale, it is quite dramatic. The other thing that's really important to flag about Leicester is they'd been seeing week on week increase and quite dramatic steep increase in the number of cases. We're not seeing that. If anything, the cases, they're fluctuating a little bit, but they're staying relatively flat and have done for about the last 3 weeks. But I am watching it. We're watching it very closely with Public Health England on a daily basis. And the moment we start to rise a little bit, they do some more analysis of the numbers, and we have a conversation about whether we need to get concerned or not. Ultimately, all of this rests on what we each individually do to keep the city safe, to keep ourselves safe, to keep that 2 meters distance and keep washing our hands.
Have you got your eye on the Black Country? Because there's a couple of areas in the Black Country that were in the 36 potential hotspots. So that's closer to here than Leicester. So.
Yeah, obviously, and let's not forget we have many families and individuals who've got close ties with Leicester. And one of the things that we have been really trying to reiterate with communities that have strongest ties with Leicester is to say the advice is don't go visit this weekend. Wait 2 weeks, let it settle down, and then you'll be able to go. But avoid Leicester at the moment and its surrounding areas, because it's important to highlight it wasn't just Leicester; it was also Leicester and its surrounding areas, which is exactly why I'm keeping an eye on the Black Country. When we came into this in March, you remember Wolverhampton and Walsall were top of the league and have stayed much higher than much of the rest of the region for a while. Now it's Stoke-on-Trent and Staffordshire have moved up, and Birmingham has been gradually moving down the rankings. So we're currently down to 7th in the region in terms of the rate of new cases. As I say, I watch it daily. And I'm watching very carefully, because there is a real risk that if one of our neighbours flips into a Leicester situation, it would be very hard to close off Walsall and not have a conversation about what Dudley and Sandwell and bits of Birmingham should need to do. So we are all talking to each other and we're keeping a close eye. So it's not just about what we do in Birmingham, it is about what we do in the whole region to keep ourselves moving forward safely.
And we do like to put the positive on things as well when we talk about these matters. It's not all doom and gloom. It's not all negative. Story in the press this week that no deaths recorded across the West Midlands.
Yeah, we're definitely seeing deaths are reducing, hospital admissions have been reducing. That again is something I watch very closely in terms of keeping our numbers going up. We're seeing more people who've been in hospital for a long time with COVID coming out of hospital and starting to rebuild their health and their lives. So there are, and there are some silver linings to the clouds that we've all been under about how communities have come together, how families have kept going their communication, how all of us are so much better at using tech than we were 3 months ago. And that's really helping us talk to people that we've never talked to before. I've never been in so many meetings where everyone's actually turned up because they can just log in, and that's really helped us to connect with other people.
The Birmingham COVID-19 Local Outbreak Control Plan is available for you to download on the Birmingham City Council website. It was penned by Dr. Justin Varney, the Director of Public Health, published earlier this week. Dr. Varney, thanks very much for joining us on the show.
Pleasure.